Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 330,503 confirmed cases of COVID-19 in Canada and 103,912 cases in Ontario. Chatham-Kent has 473 cases, and Sarnia-Lambton has reported 401 cases. Michigan now has 302,705 cases, with 18,582 cases being in Detroit. Today, we are reporting 36 new cases of COVID-19 in Windsor and Essex County. 18 are close contacts of confirmed cases, 4 are community acquired, 2 are travel related to the US, and 1 is a healthcare worker, and 12 cases are still being investigated. We have had 3,326 cases since March. 2,939 cases are now resolved, and 310 cases are active and being followed by our health unit. 15 people are currently in the hospital and 4 people are in ICU. Our community has lost 77 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 5 long-term care and retirement homes experiencing a COVID outbreak. There is 1 outbreak in the agri-farm sector and 1 community outbreak in a post-secondary student residence. There are currently 2 schools in outbreak. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your number of contacts. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering if you cannot maintain a 2-meter distance from others. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID Exposure Alert app at canada.ca. For residents of Windsor and Essex County, testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 testing and assessment centers. Windsor Regional Hospital at Olette Campus and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. As we continue to see more and more cases every day with no relief for our public health staff, we are finding it more and more challenging to support everything else that is not public health role. I think it is important that all of us as individuals, business, institutions, agencies, departments, take their role seriously and do their part in this pandemic. Remember, not everything is linked with COVID. There are a number of other guidance documents available for different sectors and the number of work that all of us have to do to keep us moving in this pandemic. I would request all of you as individuals, as agencies, as departments, as business, as institutions, to look into your own role and fulfill your responsibility instead of defaulting it to public health. Today, you will notice that I have prepared a PowerPoint slides with some of the data that we are seeing right now, and with a lot of activity that's happening in the last few days with respect to cases. I feel that it's important that we quickly bring it back to what we know and some of the areas of pressure that we are seeing right now, and also to help community understand how we can do our part in preventing some of these spread that's happening right now. So I'll move on to our PowerPoint slides right now. So just to give you a quick understanding of how these cases are accumulating in Windsor-Essex. And in the last couple of months, we have seen a flattening of the curve, but now we are seeing a steep increase in the number of cases as many of the other jurisdictions and many of the other places are seeing. The steepness of this curve is significantly higher than what we have seen in the first wave, and that is one of the most concerning things, because we know it was almost about a month ago that Teresa reminded me that we reported 0 case in a day, and look at where we are right now with high number of cases, and that highlights the significance of how quickly when we're talking about the spread, it's exponential spread. It doesn't accumulate every day one by one. It exponentially increases, and with the rate that we are going, we will be on a track for a very dangerous path. And as we know, the modeling data from the province, we looked at the modeling data from the federal government. All of that are pointing out to the fact that we could head easily into case counts of 6,500 cases a day in the province of Ontario, while currently we are reporting close to 1,500 cases a day, and how much of an impact that would have not only in the community, the impact it would have in the general public. It would impact it on the health system capacity, public health capacity to case and contact manage. And how quickly, if we lose that case and contact management control and the whole idea of containment, then there will be limited ability for us to follow up with the cases, limited ability for us to reach out to all the contacts, and limited ability for all of these spread to contain. So it's important that we take it seriously. We understand some of those roles very seriously, what we need to do our part in keeping our community safe. So just as in a comparison, what does the 7-day moving average look like? So since from the beginning of the pandemic, we have seen at least two major spikes, first in the initial phase of the pandemic, and then we have seen a lot of activities in the month of June and July. And now we are seeing something in the last few weeks in the month of November, as we can see that with the spread of outbreak in multiple settings, including the long-term care homes, schools, community, it's happening pretty much everywhere. And with the pace that we are going, we are getting into the part where we can easily exceed the previous numbers and could overwhelm the entire healthcare system, entire public health capacity, and a widespread transmission of disease in the community. Looking further in terms of the actual rates, and as we can see that the rates, what we are seeing is pretty much similar to what we have seen in the worst phase of the pandemic in Windsor-Essex, and just the steepness and how quickly we are getting to that point, I think that's significant for all of us to understand. The geographical distribution of cases just in the month of November, what we are looking is almost more than three-fourths of the cases are coming from the city of Windsor. And some coming from Leamington and Kingsville, while the other municipalities are in November didn't show any cases. From an age breakdown perspective, this is also something which is new and concerning, is the breakdown of cases, where these cases are happening. And 20% of our cases happen in individuals between the ages of 0 to 19. And a lot of them are linked with the school outbreak that we are seeing right now, but also something that is a shift in terms of what we have seen. Most of the cases we have seen throughout this pandemic was in the working group between the ages of 20 to 40, with some activities in the 40 to 60 age range, and with minimum activities 60 plus. But that trend is changing, and as we can see, the cases, especially in November, is happening more and more in the younger population, which is a shift from what we were seeing before. Some of the behavioral risk factors where these cases are happening are linked with the household contact with the case and close contact with the case. So especially when what we were talking about in the last couple of weeks is about the social gathering piece, that how these social gatherings are impacting all these individuals and how quickly it's contributing to the spread of the disease. So we can see 80% of the cases are resulting from close contact, either as a result of a small gathering, social gathering, or through direct close contacts. Something that we need to be mindful of. We need to think about every time that we are seeing someone, we are meeting someone, by default, we should assume that they could be positive and take appropriate precautions. So that's one of the key things that we need to talk about. One of the other things that you can see is roughly around 10% of the cases are travel outside of the province of Ontario, which is, and again, a concern. We need to recognize that this is still a pandemic. It is not over. And people who are traveling outside of the province or traveling to anywhere, they are putting themselves at risk. They are putting themselves at a higher risk of exposure, if nothing else. And any kind of increase in your exposure list, any kind of increase in the close contact risk, it puts everyone at risk. So we have to be mindful of that. From an occupational risk perspective, no surprise here. Majority of them, as we can see, are student because of our outbreaks in the school. And the second most important risk group is the farm workers, because we had a farm that was declared under an outbreak. And 6%, close to 6% of the healthcare worker coming back positive. This is also something that we really need to look again. That's exactly what happened in the beginning of the pandemic, when we had many of the healthcare workers coming back positive. Either we are talking about healthcare workers who were living in Windsor-Essex and working in Michigan, or people who are living here and still working in many of the healthcare setting. What essentially it points out to the either lack of following all those guidance, all those practices, or just sheer exposure number that we are having with many people having these parties, these interaction with high-risk people, potentially exposing themselves, potentially bringing it back to the high-risk vulnerable population, and that could easily set a dangerous trend throughout the community. When you have a healthcare worker who's not identified, and if that healthcare worker, if they're not taking precautions, if they are spreading it to any long-term care home, retirement home, or any place of setting where these vulnerable people are, it can easily lead to a disaster. It can easily lead to a spread of that virus in that institution and potentially shutting down that institution or making many people sick, even some of them needing hospitalization or ICU care and whatnot. So we have to be really careful, and when we're looking at all these numbers and where these numbers are coming from. Also, to note is the education staff teacher as well, and then the importance of following all those also following the public health guidance when it comes to protecting everyone, including themselves. Looking at the student breakdown in November, most of these cases are from the elementary school, as we have seen, because of these outbreak that we have declared, but we have also seen secondary school type outbreak cases, and then we have some cases from the post-secondary institution as well. So this is a day-to-day exposure source in November, and as Teresa mentioned this every morning with respect to where these cases are from, whether they're a result of close contact, whether they're a result from a travel or community. So this is a day-to-day breakdown of all the cases that we know of, and obviously there may be sometimes delays in where these cases are coming from. So what you can see here is in the red are the cases that are spreading through the community. So any type of community transmission that's happening, it's captured in red. Any type of close contact, which may not necessarily be a household contact, is represented in green. All household contacts are represented in the yellow or orange, and then all the outbreak-related cases are reported here as in the blue or gray shades. And then we still have some travel-related cases. So all of these is painting a picture that we are getting cases from all these different sources. And it is important that we recognize that it's not a problem that is linked to one specific sector, one specific activity. It's pretty much everywhere, and we need to be mindful of that. Everyone, and I will repeat it again, everyone you're meeting, by default, assume they could be positive and take your precaution. That's the only way you can still prevent any spread of the disease. And always maintain your physical distancing. And if physical distancing cannot be maintained, wear your facial covering, a cloth mask, to protect everyone around you from a source control perspective. So these exposure, again, as we highlighted, that many of these exposures are happening as a result of close contact, and the most common exposure location type is the private residence, where it's pointing out to all these private gatherings and parties that we are seeing right now. And then we have significant cases from the elementary school, and then from the hospital settings, and then the long-term hospital long-term care home settings, and then the businesses and the rest of the exposures in different areas. So now focusing on the outbreak that we have recently declared at Begley School, and by far this has become the largest outbreak in the school outbreak in the province. We now have 39 cases as a result of this outbreak, 37 confirmed cases, and 2 probable cases. And out of these 39, 29 are confirmed students and 2 probable students cases. And then we have 88 confirmed cases in the staff. From our investigation, our presumed index case is a staff person who came to the to the school and potentially led to the spread of the case in the school setting. This is what it looked like from the for this particular outbreak perspective. From the cases, when it started, we had our earliest case on November 8th that was linked, that was identified in the school, and then continued to go on to spread. And right now we are already up to 39 cases in that school setting. As I'm reporting all of this information and data are still collected and are currently being linked and entered into the system to paint a better picture of the spread, that how it happens. And from a control perspective, dismissing the school, the entire school, really helped us from a control perspective so that there is no ongoing transmission. But we also like to understand the spread of that, how this spread happened and how the infection moved from one cohort to another cohort or to infected the entire school. So we're still trying to paint that picture, but this gives you a breakdown of cases, and by breakdown you may get a sense of how these cases are, which grades that they will be potentially going to. So that's what it looks like, but we'll try to present more details, more information as we have, as we collect our, continue our investigation, and we'll present it back to to everyone. So in summary, all I can say is if we are looking at the incidence rate and what we can see from a week-to-week average perspective, we are getting into the numbers that we have seen in the worst case of our first wave of pandemic. It's really important for all of us to take that seriously and do our part in containing the spread of the disease and keeping our community safe. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Good morning. Just in the case of the school, I know it says that it's closed indefinitely at this point, but after you've broken that chain of transmission, wouldn't anyone who did not catch it in that 14-day period be safe? Why would the closure be extended beyond that?
So right now, every time when the school is shut down, what we are trying to do is we're trying to break the chain of transmission as you identified. And the ideal chain of transmission, breaking chain of transmission, starts to happen from 14 days, the day you break the chain of transmission, it takes at least 14 days for the person to become, to show up symptom or develop a disease. So that's the idea. Hopefully after 14 days, we'll have all those systems in place for the children to start to go back to the school. But we also have to recognize the capacity, the ability, the systems in place to ensure that if anyone who was part of that 14 days, they didn't develop any symptoms. They are still not symptomatic. So some of that conversation need to happen before everyone goes back to the school. So there's a little bit more that goes behind from a case management perspective. So we'll have to have all those systems in place. But generally speaking, if everything went well, we may be in a position to allow students to go back to school after 14 days of closure, but this is something that we'll have to continue to investigate before they're back to school.
And I know you said you're still kind of looking into it, but you're doing an investigation to see what happened here, why it went through so many different cohorts, and maybe what they were doing differently at this school that some of the other schools are not doing, or what kind of investigation is being done at the school level?
So there are a number of questions that we like to answer, and one of the key one is the spread pattern. That as we said, that we have let's say, a presumed index case. If that index case is the person, then how the second case happened from that person. Just like we did a cluster analysis and we presented that how in a community it spread. So now we're trying to narrow it down into the school system to see, okay, so if, for example, if a staff person was in one particular section of the school, how another case that was may or may not be linked to that particular staff person acquired the disease from that person. And then if there's any relationship between that staff person and any of the student that we are seeing, and then if they have another sibling in another class, if that's how the transmission happened in another class, or if it was just because of the layout, if it's because of any lapse in practices and protocols in that school setting that led to some of those spread. So that's where our investigation is focusing on. But we also have to recognize that, especially this school, what we are dealing with, there are many high-risk families that send their children to this school. And there are a number of social determinants of health issues that we are also addressing in this school. So we have to take all of that into consideration when we are looking into our investigation. The other important aspect of this investigation is the complete dismissal of the school. And with our health system partners, we were able to offer testing to all of these students. And from a case finding perspective, it really helps to understand that how the other students may be impacted by it. We recognized earlier on that the outbreak or these cases are not necessarily limited to one particular cohort or one particular setting, and there may be more because of what we knew in the beginning of our investigation. So we expanded it across. So we'll have to look into it, but there are a number of questions that we're still answering, and based on the answers that we get, we may have more questions. So this is an ongoing investigation, but we will try to present as much information as possible to keep everyone in the loop. But as we're speaking, we also have another school that is currently being investigated. So we'll have to look and wait and see what the case counts from the second school looks like. So we could be in a bad shape very quickly. So the important piece is we need to recognize what is at stake and how quickly things can get worse.
Are there any new cases linked to the WJ Langley?
We are obviously every day we get a list of the cases. Some of that testing happened over the weekend, and we'll be looking at at the cases that are reported to us. At this point, there are still a few cases that are under investigation, and unless we investigate, we can tie it back to the schools. We won't be in a position, but tomorrow we may be in a position to report if there are any additional cases at Langlois.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Can you tell us anything else about the index case? You've identified that individual. You know where they contracted COVID?
No, when we are saying about the index case, that means we may not necessarily know where they have acquired. It could be a community acquisition, but they could be the one who spread it to the rest of the school. And again, I'd say it's not to blame that index case that this happened because they didn't follow anything, but I think it's just how when you're trying to work through an outbreak investigation, you try to identify the spread based on that information, and that information changes as well. It could be another person who may have infected the presumed index case in the situation, and then we just still didn't get to that person yet. And then if we interview, we put all those things into time, place, and person, and then we start to plot that out to know who developed symptoms first, who got tested first, or who could have been in their infectious period and then potentially exposed others, and in that period someone developed the disease. So that's all part of the investigation. What I can tell you from the presumed index case, we didn't know how this person acquired. There are a number of other exposures that happen, but we won't be able to pinpoint and say that the index case acquired their case in any particular setting. But through that index case, we do have evidence that there are transmission that happened because of the exposure to index case.
Okay, and then separately, you mentioned that many of the individuals and the families involved at the school are high risk in some capacity. What did you mean by that?
Well, some of them are low-income families with children going to different schools. Their inability to cohort, their inability to keep them safe, and even just some of the language barriers that we are seeing. Understanding the health literacy piece from the screening perspective, ensuring that they are providing all the right education to their children. So there are a lot of issues there that has always been there. But I think because of the spread, it is just now showing more and more evident in terms of how some of these families are impacted more than the others.
Okay, thank you.
Any questions from AM 800?
I just have a quick question before I ask my questions in regards to the YouTube feed. I know the layout has changed. Under Outbreak, it says 5 under long-term care, 1 workplace, 1 community, 2 schools. What's community?
The community one is the student residents that we were following. It's probably coming to the end right now, but it was the student residents one.
Okay, just wanted to get that. Dr. Ahmed or Teresa, last week you told us there was about 430 people who work or attend the school. Windsor Regional set aside dedicated testing for Bagley. Do we know out of that number, that 430, how many went to go get tested? I know obviously you're strongly encouraging them to get tested. Do we know how many people went over the weekend?
I have that information. Just give me a second, Rob, while I look at that. So the Windsor Regional Hospital tested 283 students out of roughly 450 students, 47 staff, and 141 family members from that school population. So that gives you a total of roughly almost 470 people roughly altogether who were tested as the result of this initiative.
Okay, thank you. Do we know if any family members or any of the contacts of these students or staff have tested positive at all?
Yes, there are, and that's why I'm saying that there's a lot of investigation that's going on. We are trying to put it all together into some sense, and especially in terms of the spread pattern, because that would really be helpful, because some of these family members have students going into different schools. So maybe they have acquired the disease from, let's say, Bagley, but one of their sibling is going into another school. And if they're also positive, what are the impacts it may have on the other school, and if we need any additional investigation in that other school. So we are trying to piece it all together, and also from the family members, if they're positive, what's their, like, where do they work, and what kind of risk that they're putting into their workplace. So all of those information is we are reviewing, but we do have evidence of all the possible combinations that I just mentioned about a student with a sibling going to another school, parents who are working in a different setting, and potentially putting that workplace at risk as well.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I'm wondering, kind of following up there on AM800's question, do we know that total number of cases that have resulted in terms of family members or other contacts? Like, is there a number for that?
We do have a number, but as I said, I cannot give you an exact number today. That number is being worked on right now, and we will share information as soon as we are able to. We just want to make sure that our information is accurate, and it also helps us explain what it means too. So we are working on it, and we will share as soon as it's available to us.
Okay, and then just kind of a follow-up on the strain of public health resources. Are there any delays in contact tracing right now? Like, how long would it be before someone hears that they might have been in contact with someone who's positive?
So there is a strain. Our staff did work on the weekend, and as you know, we were reporting cases in excess of 40 cases a day, and we don't have a lot of staff working on the weekend, and so there is a delay, but people that are getting tested are asked to isolate, so they should be isolating pending hearing any further information from our health unit. So we are working on all of this. We do have a lot of staff. We had a meeting this morning about, further seconding staff to help with the case and contact management. So we will continue, but when you're asking about the exact, how long, our goal really is 24 hours or 48 hours. So we're still trying to work with that. Regarding the schools, we have used the school boards and their ways to communicate, like their center voice to the school community, to actually be providing some immediate direction for people that are asked to isolate. So we are using the avenues that we have available to us, but there would be a little bit of delay, but it is a strain, I can't lie.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Yes, doctor. It seems every day for about a month now you've said that you are concerned. Today, how bad are things in Windsor-Essex?
I think at this point, as I mentioned, from a data perspective, we are pretty much seeing the case rates that are equivalent to the worst case of pandemic when we were in the middle of our first wave. But most of those cases in that first wave were linked with very specific workplaces or agri-farms in particular. The challenge right now of the cases and the diversity that it's coming from everywhere, and a lot of them resulting from the community, which is much more dangerous because that means that there are more people who are outside who could be positive who are going into all of these settings. Specifically talking about the agri-farm sector, when we had cases there, these cases are generally working in the farm, with some of them maybe going out in the community with either rightly or wrongly, but the exposure chances would be limited. When you have that many cases in the community and that many families, that many close contacts, the likelihood of them attending school, the likelihood of them going to high-risk business environments such as restaurants, bars, gyms, their workplaces, the retail stores, the grocery stores, the risk of exposure to other people, other public is significantly high. So I think we are in a bad shape right now, and it can get worse. I hate to be the one to say that after we get to that part to say, oh yeah, our case count is really bad. I think the time to act is now, and we've been talking about it almost for 2 weeks now. And let me just be clear, it's not me who can solve the problem for the entire sectors, entire businesses, entire institutions. All of our public health unit staff have a very specific, clear mandate that we are trying to fulfill, that we are trying to do, and we've been doing that nonstop. Most of us haven't taken any break. There was no downtime for us except for maybe a few days that we had when we had low number of cases. But we are back to the point where we were in our worst case of our pandemic. And I think we need to own what we can and be responsible. Either we are talking about as individuals, either we are talking about businesses, either we are talking about workplaces, either we are talking about any institutions, any department, public departments, any facilities that we have. We all have a responsibility to do, and I can share, and I'll share more of those specific responsibilities and issues that I want the community to address in the next couple of days, because I really feel that we are at a very crucial time. And if we cannot get it controlled, we are looking at probably the worst case scenario and potentially overwhelming the entire community, our health system, everyone. And if we don't act right now as community, we will be in a bad position.
And then finally, I'm not sure if my colleagues in the media can attest to this, but I see a lot of comments on even my stories of people accusing us of fear-mongering by telling them what to do and things like that. But at this point, do you think people should be a bit afraid?
Well, I think we do. This is a pandemic, and I don't. It's very hard for me, and I don't even know how to explain that. People who are oversimplifying the things, and maybe whatever I'm telling you sitting in front, maybe you think that you know that already. Sure, but you need to understand that everything that we are doing here in public health, the approach that we take, the recommendations, the policy direction that we provide, it does require a lot of analysis, a lot of critical thinking before it happens. And it's not something that I just pull it out of my hat and then start to talk about it. It's not. There's a lot of evidence base to it. We always do that. It's not fear mongering at all. You have to recognize that we were talking about a potential second wave. We already said that the second wave tends to be worse than the first wave. And one of the reasons is exactly the same, that people think with the first wave, everyone is concerned, everyone is doing their part, and everyone is just trying to use all the available tools to protect themselves. But then, because of all those collective action, we avoided the surge that was seen in New York. We avoided the surge that was seen in Italy, in Spain, with thousands and thousands of people dying every day. The hospitals not even able to cope with the number of cases that are coming into for assessment. They had to make makeshift hospital. They have to make tough choices that who they want to save, whether they want to save your loved one or whether they want to save someone else. Those are the tough choices that they made. All of our collective action didn't let that happen here in Canada, in Ontario, and even in Windsor-Essex. But we are at that risk right now because we felt that maybe it was not too bad. It was not too bad because of our action. And we know the second wave as it's hitting in everywhere, in Europe and others. And let me just share one of those, these people who do not believe and who shares all these conspiracies and then just talk about the other regions. The data is out there. Canada has done remarkably well in many of the developed countries. And any country that they're referencing, and I'm sure that they already know which country that I'm talking about, that country is going through the worst phase of the pandemic right now as well. We do not want to leave anyone behind. We want to make sure that we are taking everyone with us. We are protecting everyone. It's not forever. And I'm just telling this again and again, it's not forever. We are coming close to the finish line. We have good, promising candidate vaccines that are available. And once it starts to roll out, we can start to see a change in where this pandemic is heading. And I'm sure that, the moment I talk about vaccine, all these people who have all these their own ideas, they will start jumping up and down about this vaccine and about, the mandatory vaccines or not. It is something that we have to address, and we need to talk about it. We can only do it when we are together and when we are supporting each other. And I think it's time to get together to protect everyone and move forward.
Thank you, Doctor.
Any further questions from AM 800?
Dr. Ahmed, with Windsor-Essex going to orange in the province's status, I just had a quick question when it comes to kind of mix it in with school, but also the bars and restaurants. For a bar and restaurant, they're only allowed to have 4 people at a table. And I know the health unit doesn't make these recommendations that come down from the province. But how is it a classroom, an elementary school, can have 30 people inside a classroom, but if I'm at a bar and restaurant, I only can sit with 3 other people? Something just doesn't add up there for me.
So that's a good question, Rob. You have to look at the risks. So every time when we are talking about, and as I said, there are a lot of information that when we are sharing, it has to go through some evidence-based approaches. So every time, every activity that I'm doing, I am attaching some kind of a risk to it. And then the more risky behavior that I am engaged in, my overall risk will increase, even though individually that risk may be lower, but overall, when I add it all up, the risk will increase. When we are talking about the school children, and if you look at some of those recommendations, and I'm not saying that that they shouldn't be wearing masks or they shouldn't be in that tight classroom or whatnot, I think the whole idea of cohorting and keeping them together is to reduce the overall risk for them. For our children, their risk, where is it coming from? It's coming from their family, and then it's coming from the exposure at the school setting. So if my family is doing everything that I need to do, my children won't be at risk. When they are going into a school setting, and unless someone is not taking all those precautions, they will be there safely. The teachers and the staff that are attending all those schools, they are taking all those precautions. They are required to wear all those masks or not. So there are a number of ways to mitigate that risk, but you cannot eliminate the risk. So it's all about adding up all those risks. So from a risk perspective, the risk is entirely different when you're talking about a child in an elementary school versus someone who is at the bar and a restaurant with number of other potential risk exposures that they have, and then how they are exposing themselves at risk. And it's about the safety of everyone, and not everyone who's going into a bar or a restaurant would be a high-risk individual. They could be a low-risk individual. So it's very hard to make some of those distinctions, but from what I can say, the risk is not the same. For someone who's in the school, the risk is low. For someone who's in the bars and restaurants, the risk is high. But as you rightly identified, those decisions, I'm not the one who is making those recommendations and decisions. It's coming out from the province.
And then finally, I know you mentioned about social gatherings. Are you concerned? This week is a big week in the United States with their Thanksgiving, us being a border city, football. I know people get together and watch the games on Thursday. Are you concerned that we could see increased numbers, I guess, early next week, above and beyond of what we're seeing right now?
We're still seeing the impacts of what Halloween parties and get-together has led to. And as I recall, even because I was asked about this question about Halloween, whether people will be doing it, whether people will be celebrating it, and I said that with caution that I have this uneasy feeling that there are a number of parties that would happen, and maybe not a lot of trick-or-treating, but the parties happen, and it's what we are seeing right now is still all of those impacts, and I really don't want us to be in the same situation with the next Thanksgiving. And when people are talking about football or any other thing, there are virtual ways to watch that, and how do you connect with that, all of those people, and we really need to find ways to do all of this thing creatively without putting anyone at risk. I think the risk, the spread in the community is high enough for all of us to take precautions and to limit our movement unless it's essential. And my recommendation is there. I really hope that people understand that and do the right thing instead of putting everyone at risk.
And sorry, one more quick one here. Like Teresa mentioned, 15 people in hospital, 4 in ICU. When it comes to the field hospital, at what level would that be given the green light to open up the field hospital? Would you give it to, I guess, Windsor Regional and Leamington, or would it be a team approach? How does that work?
So there are obviously some of these decisions are the acute care health system partners. They look at their capacity, and then they look at what is needed. So obviously, sometimes I do get consulted on those matters, and I provide my input. But generally, it's some of those decisions that comes through the acute care system pathway, and based on the capacity and the surge that we are seeing in the community. I think the last time that we used it was for the long-term care home, and since then, It's there as a backup. Let's hope that we don't get to use that. But if it's needed, I think it will be a discussion and a conversation at a different level where we can be part of that conversation to find what is the best option for our community.
Thank you. Have a good day.
Thank you.
Any further questions from CBC?
Yeah, so it sounds like a majority of staff and students have already been tested from Bagley. I think you said it was more than 400 staff and students. Are you anticipating that the cases will climb higher than where they are at right now?
Yeah, so let's just a correction. It's not 450 staff and student. I think we had 280 or so students that are tested, and 70 or so staff person who were tested, and then we've got a significant number of families from the family who were tested. So 283 students, 47 staff, and 141 family members. Yeah, so there are still some students who are not tested for various reasons. And so yeah, so just wanted to make sure that at least we keep that number straight.
Okay, so are you anticipating that the cases could climb, I guess, because we still don't know kind of all of those results?
Yes, and that's why we are trying to put all those information together and try to make some sense out of it as well. And I believe this week we will, by the end of this week probably, we'll have a better understanding of the story, what transpired, what happened, how it spread. From a control perspective, obviously, as I said, the good thing is all of these individuals, all of these students are already at home, and they're not out there spreading it out to others. So that's one way to do to keep everyone safe. But we also need to know what happened so that we can use that as a learning tool to prevent any future outbreaks in other schools.
Okay, thank you.
Thank you, everyone.
Thank you.